the children were there, and I was in the hospital room that was going to be my home for the next month. And the last face I saw was this cute little round face of my 5-year-old daughter. And she wasn't crying, but I could just see in her eyes that she didn't understand, that she didn't know what was going on. And I think that was the loneliest moment of my entire treatment.
Prior to my bone marrow transplant, there were a number of tests that were run to make sure my heart was fine, my lungs were fine, kidneys, that kind of thing. So when I did go to the hospital, everything was pretty much set. And within a day, the chemotherapy was started to rid my body of my own marrow.
The purpose of this intensive therapy prior to the transplant is to get rid of diseased cells in some cases, and also to get rid of the bone marrow that a patient has.
Started with chemo first. I went in on a Friday, and they put the chest catheter in, and then they proceeded to do chemo all weekend.
In going through a bone marrow transplant, you'll find that you are going to have many things given to you intravenously. If you were to depend upon the veins in your arm and having a needle stuck into them every time you needed an intravenous medication or a blood product, you would soon run out of veins. We found a way of getting around this. We can take a small catheter now and put it into a huge vein in your chest, actually the big vein that goes right into the heart.
It's also used to take any blood samples that we would need during the transplant process. So it prevents patients from having multiple pokes with needles to draw blood.
I wasn't frightened of chemo, but it took a lot out of me. There was fatigue. There was no pain, but I had a lot of diarrhea, vomiting, nausea. However, there was medication to help control some of that. I learned that I had to communicate whatever was going on with me, and then they were able to respond to whatever was happening.
And there is almost always something we can do. We may not be able to fix it, but there's almost always something that we can do to make you feel more comfortable and to make the day better for you.
When someone says what sick actually is, it's like maybe 3, 4, 5, 6 days of the worst flu you've ever had on a continual basis where it distorts time and you don't know if it's day or night and you're just kind of sick all the time. And then it subsides and again you get the chance to start over.
Every patient is different. They go through things totally different. I had no idea what to expect from one day to the next, from one visit to the next. And that's where I had to sit back and say, okay, so I just sat in this chair. I occupied the corner chair in his room. Oh, just me.
You're in a bed. You're out of a bed. You're walking. Oh, I'm walking. Oh, am I walking now? Am I laying down? But to be out of that and clear and bright is every reward you ever dreamed of. Every reward.
Had I not been outward with my feelings and concerns, I would not have received the treatment that I did receive. So I think it's very important to just relax and be yourself and open up, and you go to the innermost parts of yourself to be healed.
Transplant day is almost like a second birthday. It's a new beginning.
I was scared. I was anxious and scared. Wanting it to work and wondering if it was going to work.
It's a day that you look back upon, and it's a day like none other in your life because it's really the beginning of a second life.
On the day of my transplant, it was very anticlimactic. I had made preparations for this particular day, and I thought it was going to be this big hoopla, but it actually was very, very quiet, very normal. When my brother marrow was harvested. They brought it in a big bag. It looked like just a big bag of blood. It was pretty much a blood transfusion. So I sat in bed watching television and eating potato chips. It was just like being at a movie or something.
Many people feel that it's a surgical procedure. We actually have to cut the bone, or we actually have to do something dramatic to get these stem cells back into the bone marrow space to start working again. But indeed, it's the simplest of all the procedures that we do in bone marrow transplant, and that is we put them in an IV bag, which is just like a blood transfusion, and they drip into the central venous catheter. They have a homing device of some sort, find their way into the bone marrow space, and begin making a new home for themselves and multiplying.
I believe that people should look at the transplant process as a minor interruption in their lives. But I think if you just hold on to hope, it kind of helps you through the day. And maybe that's all you need to do is get through that day. And then the next day, get through that day. And once I learned to do that, it became much easier to take each day at a time. And before I knew it, the whole process was over.